So every year, millions of people die due to late diagnosis. Every year, millions of people are diagnosed with chronic diseases like diabetes and heart diseases. But what if we could change that? What if we could? What if we could see the warning signs earlier? What if we could take control of our health with the power of AI? Hello, hello, hello. So introducing lens care. So the problem with current healthcare system is it is actually often very reactive, but we wait for symptoms to appear before we seek help. So by the time we know it, it's already too late, and this leads to higher cost, more complex treatments, and poor health outcomes, and sometimes even death. So lens care changes that. It's a proactive health assessment platform that puts power of AI in your hand and let you see let's see how it's work first. So let's simply start a new assessment. So let me walk you through. Let's start it fresh. So yeah, so this is 6 pages form. So we try to take as much data as we can from the user to predict it with 95% of accuracy. Here's the main thing we are targeting. Let's fill the detail. So let's see how it's work. So it's asked a lot of details from the user because this is actually a very important thing because most of the time when a person asks a health professional or like once we like uh, Google our health symptoms or when we ask a LLM, it doesn't know everything and it often predicts so wrong and we are very confused that uh, what it said is right or not. So we try to change that by adding a lot multi-layer form. It can be very better, right? Not just a prototype. But yeah, see. So we try to show the symptoms to the user, like what kind of symptom they have. It's general, is neurological, and they can choose from like what they're feeling. And like with this, it will help to the health assessment. So from here, if we go now, it will ask you your family history. So why it asks that? It is also very important because we miss that. And even with the doctors, it's actually even bridges the gap between a patient and a doctor because even patients are not honest with the doc, and it's so painful actually. So let's choose family history. Okay, current medical. We try to take a lot more things, and if we consult a doctor professional, make this we can make this platform even better. It's just in its prototype phase. We are showing it how good it can be and how we can actually change it. How we can actually change the health sector and actually use the new tech to improve it. Yeah, it also supports lab report. The ML models scan the lab reports pretty accurately, and like I said, our goal is to do a 95% accuracy at this thing. So we are not using just one model. We are trying to use as many model as we can for like every single thing. Although it's such a pain to build a ML model, not that easy, to be honest. So yeah, that's how it will show the assessment, how like uh, what is what is at high risk, what is at low risk. To be honest, currently we have just hosted the front end, and we have not able to host backend and ML models because the time the submission window for the hack was really thin, and it is for a prototype to build a ML model from scratch. It is actually tough. But yeah, we are showing how much we have done. And our vision is to make ML model for every single aspect, use many models, use multi-model logic, and use a LLM as a universal thing to guess it accurately. We have even thought of implementing a AI chatbot to discuss the details to help the user know what they should do, what they are suffering from. So, and like with LLM having all the data it needs, it can help them very, very accurately. Then we also want to recommend the health professional they should seek. And we have this find care. So you can actually find the care around you, the Google Maps. And yeah, you can also download the PDF. So you can then show it to the health professional that this kind of assessment you got. And it is not just, we try to make it as much accessible as it can. Like for the accessibility, we have added this font thing, it bigger for the user who have some problem with the current thing. Like can be for any age of people. So this is our vision. Now let me walk you through our GitHub. This is our GitHub, CareLens, and we have all the things back and front, docs, models, and all. So this is our this is, just in the video. It is very hard to explain the code. I'll leave it the README. So yeah, this is our vision. This condition specific ML models is trained on medical data set. This is our main vision, to be honest. And yeah, this is our code functionality. And if you come on GitHub, you will see doc folder. Here we try to explain everything, how the code works, how we try to build it, what is we are doing here. And like if you go on this work folder, you will this have many docs. You'll understand the architect, how we build it. So yeah, so this was Lenskare. Thank you for watching.